The other topic which we are going to discuss now is purgatives. Purgatives are also the agents which are used to treat some sort of GIT diseases or else disorders or else discomfort which is caused because of the gastrointestinal tract. So, before entering into the actual topic, let's see what is constipation. So constipation is a condition where there will be discomfort in defecation or else in excretion of the stools. There will be some sort of discomfort or else there will be some sort of pain. So because this is because of decreased motility of the colon. So this difficulty is because if there is any or else the peristalsis movement in the colon is not proper, or else if it is that there is no peristaltic movement at all in the colon, then we can see the condition called as constipation. And this constipation is not any disease or else it is any disorder. It is just a symptom. What might be the causes of these constipation? The constipation may be because of various causes, like because the first reason may be diet. If we don't take proper fiber intake in the diet, or as if the fiber is not intaken in required amount to the body, then there occurs constipation. And this constipation is because of it as a side effect of various drugs. And this is because of lack of exercise. After taking food, if we sleep, or else if we don't do any sort of proper exercise daily, and because of age factor also, this constipation may occur. And the other reasons may be there will be the colon which is present in the large intestine. If there is any spasm to the colon, or else the colon does not show proper peristaltic movement, this proper peristaltic movement result as if there is any spasm for that particular region, then also this constipation occurs. And because of dysfunction of mesenteric plexus. Mesenteric plexus are those sort of plexus which aid in the proper peristaltic movement of any smooth muscle. These mesenteric plexus send some reflex movements where because of these reflexes which is sent, the smooth muscle shows peristaltic movement. So because of this only the GI motility will be proper. If the GI motility is not proper, then it may lead to constipation. What is the pathology, or else what might be the reasons or what might be the stimulants for this constipation? So there are various mechanisms, or else there are various pathogenic reasons why this constipation is caused. One is the abnormal intrinsic motility, that is if the motility of the gastric region is not proper. And the other one is lack of luminal factors. There are various other factors which aid in the peristaltic. If a peristalsis movement have to take place, it has to, mesenteric plexus have to send some reflexes, and if these reflexes are sent, then it releases some kind of factors or else some kind of substances in the body, and these substances they promote or else they stimulate the smooth muscles to move. So if these factors are absent or else if these factors are not present in the body, then this constipation may occur. And because of medications, there are various drugs which have side effect called constipation. So because of these drugs also this constipation may cause. And because of hormones, for example, in a condition called as pheochromocytoma. Pheochromocytoma is a condition where a tumor is developed in the adrenal gland. From adrenal gland is present on the kidney. So this adrenal gland releases epinephrine and norepinephrine. So these are the neurotransmitters or hormones which regulate various heart rates, metabolism factors, and various other stimulants or else various other reflexes or emotions in the body. So if these norepinephrine or epinephrine are not released in a proper amount, or else if they are released in the excessive amount, then there occurs increased or decreased heart rate. They affect in all these factors. So this pheochromocytoma is a condition where a tumor is formed to the adrenal gland. What is the pathophysiology behind this constipation? So there are various other reasons or various other mechanisms why this constipation is caused. For example, abnormal intrinsic motility. If there is any or else the motility of the GIT is not proper, the GIT contains smooth muscles, right? So these smooth muscles should show some motility in order for the GIT contents to be moved from one region to the another region. So if there is any abnormality in this motility, then constipation may occur. Because of few medications, most of the medications have side effect called constipation. So if these drugs are used in longer longer for chronic use, then this constipation may result. There is lack of luminal factors. So these luminal factors are the factors which aid in the motility of the GIT. That is, because the smooth muscle, in order to have peristalsis movement, the meandric plexus which are present, they send some reflexes, and because of that reflexes, there are some factors or substances which are released into the body, and thereby stimulate the smooth muscles to show its motility. So if these factors are not present, then the motility of the smooth muscle will be reduced, and thereby constipation may result. The other one is hormones. For example, in a condition called as pheochromocytoma. Pheochromocytoma is a condition where the tumor is caused to adrenal gland. Adrenal gland, where a tumor is caused due to the adrenal gland. So this adrenal gland is present in the kidney. Present on the kidney. So if a tumor is present on the adrenal gland, this adrenal gland secretes two hormones, epinephrine and norepinephrine. So epinephrine and norepinephrine, they control various emotions and situations like heart rate, blood pressure, metabolism, etc. So if this epinephrine and norepinephrine are released in decreased or increased amounts, then these factors will be fluctuated. So this pheochromocytoma is a condition where tumor is caused. Because of the tumor, the epinephrine and norepinephrine are not secreted properly out of the adrenal gland. So if these do not be secreted, then this motility of they have one of the factor called as they have one of the effect called as smooth muscle contraction or smooth muscle relaxation. So if the smooth muscle contraction and relaxation don't occur, then constipation may result. Another one is impaired defecation. So the habits, if we have proper defecation habits, or else if we defecate stools on regular basis, then there won't be any disturbance, or else then there won't be any discomfort in excreting the GIT contents out. So if a person don't have proper lifestyle also, he may have the chance of getting constipation. What are the symptoms of this constipation? How we can say that if a person is suffering from constipation? So we have the symptoms like nausea, vomiting, anorexia, that is loss of appetite. He don't feel like eating anything as the stomach is already full. And the other one is erectile bleeding. If this constipation is in severe condition, then there will be pain in the defecation of the stools, and sometimes because of the rupture of the capillaries which are present in the rectal region, there may be rectal bleeding occurring, and there will be weight loss in the patient, and there will be the stools which are defecated out, it will be very hard for the person to defecate, and sometimes he vomits also, and there will be some sort of discomfort in him. How we can diagnose? There are three ways to diagnose. The first one is by seeing the history of the patient, by observing his diet, whether he's taking proper vegetables, fruits, or proper fibers, or whatever we require, the balanced diet is taken by the patient or not. And the other one is his eating habits, his daily exercise, his age, his hereditary, as well as his toilet habits, as well as whether if he is prone to some medications, because of the medications, whether this constipation is caused or not. By seeing the patient history only, we can diagnose up to some extent. If we can't diagnose, then we can go for the basic laboratory tests like CBC, that is total blood count or cellular blood count, and BS is nothing but blood smear test. BUN is nothing but blood urea nitrogen test. The other one is creatinine test. The other one is thyroid stimulating hormone test. So by observing, performing these laboratory tests, we can say whether the person is suffering from constipation or not. And in other cases, by performing other tests like sphygmoidoscopy and colonoscopy and barium enema, we can also diagnose the patient if he is suffering from constipation or not. What are purgatives? Purgatives are the substances or the chemical agents which promote defecation. They make the stools loose, or else they make the stools soften in order for the stools to get, in order for the gastric contents to get out of the body or excreted out of the body. So these purgatives play a very major important role, and they used to treat constipation. what is the mechanism of action behind this purgatives? So this, whatever the purgatives it may be, they have different mechanisms, but the overall mechanism is like they decrease the viscosity of the gastric contents to be excreted. When this viscosity of the gastric contents is reduced, then thereby the gastric contents which are the undigested food which is present in the body can be eliminated out. And what are the indications, or else how we can indicate that these contents or these purgatives can be used? They are used in constipation, they are used in anal fissures, they are used in hemorrhoids. Hemorrhoids are nothing but piles, and they are used in IBS, that is irritable bowel syndrome. In all these conditions, these purgatives can be used. And what is the treatment for constipation? There are two types of treatments. One is non-pharmacological treatment and the other one is pharmacological treatment, that is drug treatment. So what is the non-pharmacological treatment? Non-pharmacological treatment is nothing but taking proper diet. We have to make sure that the person is taking proper fiber in his diet, and the other one is regular exercise to the patient is necessary. Another one is regular bowel habits, and avoid drugs which cause constipation. If a drug is having any side effect, then we have to avoid or make sure that we are not taking that drug for chronic period of time. And what are the pharmacological treatment, or else what are the category of the drugs which come under purgatives? There are various categories like bulk purgatives, osmotic purgatives, stimulant purgatives, lubricants, fecal softeners or surface acting agents. These are 5 categories of the purgatives which are used for the treatment of constipation. What are bulk purgatives? So in this bulk purgatives also we have 3 categories. One is dietary source, that is dietary fibers, which are the fibers which are used as a supplement for diet. For example, undigested polysaccharide vegetables, fruits, grains, bran, pectin. These are the dietary fiber sources for this bulk purgatives. And the other one is there are the substances or the agents which are extracted from the plants naturally. So these naturally extracted plants include Xylem seeds. So Xylem seeds are the one which are very effective for constipation, and methyl cellulose, carboxymethyl cellulose can be used. And synthetic derivatives which are prepared artificially or which are prepared synthetically are calcium polycarbophil. So calcium polycarbophil is a drug which is in the form of resin, and this resin is not absorbed in the body so easily. It needs to have some additive in order for this resin to get absorbed into the body. What is the mechanism of action behind this bulk purgatives? So these bulk purgatives, when they are intaken into the body, what does it do? The non-digestible food or else non-absorbed food which is present in the gastric contents, these bulk purgatives, they add fluid to that. These bulk purgatives, when enter bulk, the name itself indicates, they add some quantity to that food. So the undigested food which is present, these drugs, they absorb the water. When water is absorbed into by these drugs, they add some addition to the gastric contents, and when fluid is added to that undigested food, then it becomes soft and it is very easily defecated. And if it becomes soft, then the peristalsis movement of the smooth muscle will also be good, and thereby they act against constipation. What are the side effects of these bulk purgatives? These bulk purgatives are side effects like they have delayed onset of action. That is, when they are intake into the body, they do not show rapid action. Sometimes they at least take 1 to 3 days in order for the drug to show its actions. And the other one is intestinal obstruction. Sometimes these bulk purgatives, because of the excess water absorption, if there is any excess water absorption, thereby the intestinal region, these gastric contents may get obstructed, or else they can be blocked. In the intestine, the gastric contents can be blocked, and sometimes it may cause malabsorption syndrome also. And if these bulk purgatives, they interfere with other drugs, then it may cause the low bioavailability, or else they may not allow that particular drug to show its actions. For example, these cardiac glycosides. So when these bulk purgatives are given in combination with cardiac glycosides, then the cardiac glycosides will not have any effect. Then, what are the clinical uses of these bulk purgatives? These bulk purgatives can be mainly used in constipation, in hemorrhoids, that is piles, in pregnancy, if a pregnant lady is having constipation, then these bulk purgatives can be given, and in IBS, that is irritable bowel syndrome, and in ulcerative colitis disease. So mainly these are the clinical uses or therapeutic uses of these bulk purgatives. The next category of the purgatives are osmotic purgatives. So osmotic purgatives, in the name we can see the name called as osmosis. So what is osmosis actually? So osmosis is a process, it is a physical process where the movement of molecules takes place from higher concentration to lower concentration through a semi-permeable membrane. For example, if we take any two regions or two liquid regions. So in one liquid, the concentration of molecule is high, and in other the liquid, the concentration of molecules is low. So in higher concentration, the higher concentration molecules move from that particular region to lower concentration, but there should be a semi-permeable membrane for this movement of molecules. So this process is called as osmosis. So these osmotic purgatives act by the mechanism called as osmosis, and these bulk purgatives are very soluble in water, and that is the reason, if they are very soluble in water, they can increase the gastric water content in the intestine. So what are the drugs which come under this osmotic purgatives? There are organic drugs as well as inorganic drugs. So in organic drugs, these are nothing but sugars. For example, there is lactulose and polyethylene glycol. These are organic sugars which are used as osmotic purgatives. And non-organic salts, like non-organic salts are also called as saline purgatives, because these are the salts. So these are the salts of calcium, magnesium and sodium. So the magnesium salts include magnesium carbonate, magnesium hydroxide, magnesium oxide, and the sodium or potassium salts have sodium citrate and sodium phosphate, or potassium citrate and potassium phosphate. What is the mechanism of action? So when the osmosis is occurred, because of the osmosis, the water is absorbed, right? So in the gastric region, if these osmotic purgatives are induced, then because of this osmotic purgatives, the concentration, the water molecule concentration, if it is high, or the fluid concentration which is high, from the outer region, the higher concentration to the lower concentration, they aid in the movement of these fluid molecules from outer region into the intestine. And when this water absorption is occurring into the gastric region, then the undigested food or hard food material which is present, it becomes softened, and thereby the viscosity is decreased. And if the viscosity is decreased, thereby they aid in the stretching of the, they aid in the stimulation of the stretch receptors which are present in the GIT region, and thereby the peristalsis movement occurs. If the peristalsis movement is proper, then the gastric contents can be excreted out. And lactulose. So lactulose is a drug, or else it is an organic form of osmotic purgative, and this lactulose when it is metabolized, so when this lactulose is taken into the body, in the colon region we have some bacteria. So these bacteria, these are useful bacteria which are present in the body, and because of this bacteria, the lactulose which is present, it is metabolized to glucose as well as fructose and galactose, or in this galactose is further degraded to glucose molecules. So these form lactic acid as well as acetic acid. These bacteria, when this metabolization reaction takes place, they form lactic acid and acetic acid, and these sugars, these lactic acid and acetic acid, they aid in the fermentation of the sugars. When these sugars are fermented, then this osmotic purgative action can take place by these drugs. But these lactulose also have side effects, like it also has delayed onset of action. The onset of action is for about 2 to 3 days. After intake into the body, it shows its action after 2 to 3 days. And if it is taken in excessive amount, it may cause some abdominal cramps, or it may cause some flatulence. If this lactulose is taken in excessive amount, then lactic acid and acetic acid are secreted. So if this lactic acid and acetic acid, because of the metabolism of this lactulose, then there will be gases releasing into the gastric contents, and when these gases are released, then we can see a condition called as flatulence, and because of that the abdominal cramps may occur, and it has electrolyte disturbance also. The metabolism aids in the release of various water molecule, carbon dioxide and various other ions also. So when these ions are released, then there will be, these ions go and bind to that electrolytes which are present in the body, like sodium, potassium, calcium. If they bind, the electrolytes which are available in the body will be reduced. Then there will be electrolyte disturbance occurring. So this lactulose is mainly used in liver cirrhosis. Why it is used, or else why lactulose is preferred for liver cirrhosis? We can see the mechanism here. Lactulose, it degrades into fructose and galactose, and this aids into the release of lactic acid and acetic acid. So this lactic acid and acetic acid, because they are acids, right? When they are released, then it makes the colon form, or else it makes the colon to have acidic situation, or else the acidic situation is created in the colon. And when this acidic situation is created in the colon, this acid, it neutralizes the ammonia which is present. So liver cirrhosis mainly caused because of the ammonia absorption, or else ammonia compounds, if they are absorbed in larger amount in the liver, because of that the liver cells that are hepatocytes, they get damaged. So this lactic acid and acetic acid, when acid environment is created in the colon, they neutralize or else they decrease the ammonia absorption. When ammonia is absorbed in lower amounts, then this liver cirrhosis can be prevented. In this way they are acted, and this liver cirrhosis, this lactulose is very useful for liver cirrhosis. We have saw the organic sugars of osmotic purgatives. Let's see the saline purgatives. These are the non-organic forms of osmotic purgatives. So these saline purgatives, we saw magnesium salt, sodium salts. So what is the action of these? They have rapid effect. Once they are administered within 1 to 3 hours, these saline purgatives show their action. And the other one is the magnesium salt. The available salts which are present in the market are magnesium sulfate, magnesium oxide and sodium phosphate. So magnesium sulfate is marketed in the Epsom salt form, and magnesium hydroxide is marketed as milk of magnesia, and sodium phosphate. So these are the available salt forms which are marketed as purgatives. What is the mechanism of action? So these saline purgatives also, what does they do? The name itself indicates these are the electrolytes. So these electrolytes, they aid in the water reabsorption. So when these saline purgatives are taken into the body, they aid in the water reabsorption. When water is added into the GIT contents, then there occurs increased motility, and thereby the gastric contents are expelled out. So all the purgatives show the same action, but the mechanism by which they act is different. So we saw, for example, the bulk purgatives exert their action by stimulating stretch receptors, whereas osmotic purgatives, they add water contents by a mechanism called as osmosis. But the main result is that water content is added, or else the viscosity of the GIT contents is being reduced, and thereby the gastric contents are expelled out. What are the uses of these saline purgatives? These saline purgatives are mainly used to treat acute as well as chronic constipation, and there are few side effects also for these saline purgatives. The main side effect is like the electrolyte imbalance. These saline purgatives, they dissociate very easily, and thereby they get bind to the chloride ions or H+ ions, and thereby the electrolyte imbalance can be caused. And the other side effect is invascular volume depletion. So if these electrolytes are present in excessive amount, the more water reabsorption takes place, or sometimes the water molecules which are to be required for the body, they get dissociated into H+ and O+ ions, and thereby there occurs depletion of the volume or else fluid contents which are present in the body. what are the contraindications of these osmotic purgatives? So we have to make sure that these osmotic purgatives should not be given to elderly patients, because these osmotic purgatives have a side effect of electrolyte imbalance. If there occurs any electrolyte disturbance in elderly patients, it may cause severe cardiovascular or other renal effects for that elderly patient. So that is the reason they should be contraindicated in elderly patients, and they should be contraindicated in renal failure patients. If a person is having any discomfort or else any disease which is related to renal system, then these osmotic purgatives are contraindicated. And the sodium salts are strictly contraindicated in congestive heart failure. In any cardiovascular disorder, sodium salts play a major role. So if the sodium content is available in more, then the cardiovascular disease or disorder can be worsened. So that is the reason the sodium salts should be contraindicated in mainly CHF, but other cardiovascular diseases also. And these magnesium salts should not be given if a person is suffering from heart failure or stroke or shock or any CNS disorder. These magnesium salts should not be given. The next category of drugs are stimulant purgatives. The drugs which come under the stimulant purgatives are bisocodyl, that is marketed as Dulcolex, and the other one is anthraquinone derivatives. The other one is castor oil. So, what is the mechanism of these stimulant purgatives? So these stimulant purgatives, they have direct action. So the enteric nervous system, this enteric nervous system play a very major important role. When this enteric nervous system is stimulated, smooth muscle contraction takes place. So when this smooth muscle contraction and relaxation is occurring properly, then thereby the peristalsis movement will be very good. So these stimulant purgatives, they directly stimulate or else they directly act on the enteric nervous system, stimulating its nerves, and thereby the peristalsis movements will be good. And so this bisocodyl is marketed as Dulcolex, and it acts mainly on the large intestine region, and its onset of action also, when compared to Lactulose or else the other saline purgatives, this bisocodyl has little more onset of action. In the sense, this bisocodyl onset of action is about 6 hours, but saline purgatives act for about 1 to 3 hours. So, but these bisocodyl is most preferred than saline purgatives as they cause electrolyte imbalance. And the next drug under the stimulant purgatives is like castor oil. So this castor oil, it is a fixed oil degraded by lipase in upper small intestine. So when this castor oil, it is taken into the body, then it degrades into a compound called as glycerin and ricinoleic acid. So this castor oil as such do not act. When it gets degraded, when it forms ricinoleic acid, this ricinoleic acid is the active compound which exerts the action of purgation or else which exerts the peristalsis movement. So this, what does it do? This ricinoleic acid, it is mucus irritant. So when the mucus is getting irritated, then there occurs some sort of stimulation in the smooth muscle, and thereby it acts on the this act on the smooth muscle, and thereby it causes peristalsis movement. And the onset of action of this castor oil is about 4 hours, and it has 5 to 20 ml on empty stomach in the morning. So this castor oil, if it is given 5 to 20 ml early in the morning without or else on the empty stomach, then only it shows its action. If it is taken with food, it does not exert its actions because it's not degraded into ricinoleic acid as well as glycerin. But the main side effect of this castor oil is like ricinoleic acid, which is gastric irritant. If this gastric irritant capacity or else if this gastric irritant nature of this ricinoleic acid is more, then there will be severe adverse effects when compared to stimulant effects. Anthraquinone derivatives. So anthraquinone derivatives are the compounds or else the drugs, the natural compounds which come under these anthraquinone derivatives are senna, aloe as well as cascara. So these are the plants derivatives which come under the category of anthraquinone derivatives because they contain anthraquinone glycosides. So these are the glycosides. They have, for example, senna. Senna has glycosides or as anthraquinone glycosides which are having purgative effect. Because of the glycosidal presence only, this it can show purgative effect. So these glycosides are extracted by various extraction procedures and they are marketed. So this glycosides, when they are entering into the colon, they get hydrolyzed because of the bacteria present in the colon region. They get hydrolyzed and they release a compound called as amodin. So amodin is one of the useful compounds, or is one of the useful contents which show purgation effect. For example, the absorbed amodin, once the in the colon, if these anthraquinone derivatives are present, because of bacteria, the glycosides get dissociated. So these sugars will be eliminated as such from the body, and this amodin, what does it do? Once it gets absorbed, it directly acts on the myelinic plexus. So as I told you, myelinic plexus, it's in some sort of reflexes, and thereby smooth muscle peristalsis, or contraction or relaxation of the smooth muscle takes place. So this amodin, it goes and directly stimulates the myelinic plexus, and thereby increases smooth muscle contraction occurs, and thereby it can show purgative effect. And this bowel movements, or else the movement of the smooth muscle, can take place based on the route of administration. For example, if these anthraquinone derivatives are taken orally, then they have the bowel movements for about in 12 hours. I mean, the onset of action, we can say indirectly the onset of action. The onset of action for orally taken anthraquinone derivatives is 12 hours, but if they are taken rectally, they exert their action in 2 hours only. So they are, they can be given in two routes of administration, that is intrarectal as well as orally. And these anthraquinone derivatives, mostly they are given during night times. What are the side effects of these anthraquinone derivatives? If the dose increases, or else if they are taken in higher doses, then it causes abdominal cramps. And in prolonged use, if they are used for prolonged use, then they cause dependence of this myelinic plexus. In the sense, after certain dose, this myelinic plexus won't have, these anthraquinone derivatives won't have any effect on myelinic plexus, and thereby they are taken in the sense, we can say they become tolerated. These drugs become tolerated for the stimulant effect of this myelinic plexus. And these contraindications. What are the contraindications of these drugs? So anthraquinone derivatives should be contraindicated. For example, mainly the senna. The senna anthraquinone derivative drug should be contraindicated in lactation, and the castor oil which is present should be contraindicated in pregnancy women, because this castor oil, what does it do? It causes reflex contraction of the uterus. It produces some reflexes where it causes contraction of the uterus, and excessive contraction of the uterus can lead to abortion. The other category of drugs are fecal softeners or surface acting agents. So what are these drugs? Before that, what is surface tension? Surface tension is a tension which is created by the molecules on the surface of the liquid. On the surface of any liquid, if molecules are creating some sort of tension, then that is called as surface tension. Because this occurs because of the attraction of the molecules to the liquid molecules, and these surface tension are caused mainly because of the surfactants. So the surfactants, what are these? The surfactants are used in fecal softeners. So what are the surfactants, or else what are the characteristic features of this surfactant should be? So these surfactants, what does they do? They decrease the surface tension of the fecus. For example, the drugs like docusate. Docusate contains sodium dioctyl sulfosuccinate. So this docusate, it contains this drug, and what does this surfactant do? It decreases the surface tension in the fecus. When the surface tension in the fecus is decreased, then thereby it can be or else it can be eliminated from the body easily. These fecal softeners are given either orally or else rectally also, and these rectally they are given in mainly in emergency conditions, like, or else if a person is hospitalized, or in surgery conditions. If gastric contents are to be eliminated out for a surgery, before surgery, the bowel contents or gastric contents should be emptied, or else the stomach should be emptied. So in that conditions, enemas are used. Enemas are the substances which empty the bowel contents or gastric contents before surgery. So these fecal softeners are mainly preferred for this before surgery or for hospitalized patient. The other category of drugs are lubricants. So in these lubricants, liquid paraffin as well as glycerin are used. So these lubricants, they mainly have the mechanism of action, like they add slippery nature to the fecus. They make the fecus soften, and they create an environment which is lubricating effect. What are the side effects of these lubricants? Mainly liquid paraffin. So liquid paraffin is not palatable in taste. That is, it is not very good in taste. So it's not palatable. The other one is it impairs the absorption of fat soluble vitamins. So these vitamins are very essential to the body. If absorption of these vitamins are not proper, if the absorption of these vitamins are impaired, then they occurs vitamin deficiencies, and the increased activity of oral anticoagulant. If a person is taking oral anticoagulant as well as these lubricants, then it may cause increased effect, or else the coagulation effect of these oral coagulants, anticoagulants will be more. The action of these oral anticoagulants will be more, and there will be excessive blood loss for that patient. What are these enemas and suppositories? So suppositories are the marketed formulations. These are hard, conical or pyramid shaped formulations which are administered through vaginal or through rectal route for emptying of that particular region, or else for creating some sort of alkaline environment for that particular region. And enemas are the substances which are used to empty the gastric contents. So these mainly are used in bowel movement syndrome also. The suppositories as well as enemas are used if there is any improper bowel movements, and they are used in hospitalized patients as well as they are used in surgical conditions. For example, the enemas, the suppositories which are used, like there are glycerin suppositories which are marketed. So these glycerin suppositories, they stimulate the rectal secretion by osmotic action. So these glyceryl suppositories, once administered into the body, what does they do? They aid in the osmosis action, and thereby they causes rectal stimulation. I mean, the stimulation of the rectal region takes place, and thereby the gastric contents will be eliminated out. And they are phosphate enemas, but there is a risk for these phosphate enemas. If these phosphate enemas are taken in for a longer period of time, then it may cause hyperphosphatemia in renal impairment. There will be increased amount of phosphate secretion, and thereby there occurs renal impairment. So that is the reason we have to make sure if a person is suffering from renal failure or kidney related disorders, should not be given this phosphate enemas.